My name is Patricia Booth, and I'm a doctorate student at Nova University. I started in 2012, and my topic for dissertation is the Affordable Care Act. I have 3 more semesters left to graduate, to finish proposal, and 2 more classes. The reason I chose the Affordable Care Act had to do with my work as a social worker, with my second master's. I have a master's in religion and I have a master's in social work from Barry. And I chose that because of my work with seniors and people with disabilities. I've studied it since the seed money began for 26 states, and 24 adapted not to do the Affordable Care Act when it was passed. Research shows 5 years later that the 24 states who did the seed money are far better off than the Affordable Care Act. It implemented many things, and I have a map that goes into 2 sections. It implemented a new code which doubled in size. There used to be 4 codes for a knee injury. Now there are 24. They also have 4 codes for a macaw bird bite. And what's very interesting about it is it took away the rights of the people working with their relatives. One of the things that was implemented at age 74 was that the physician had to discuss end-of-life decisions. Many physicians did not like that. They knew the family, they treated the patient or the client for 24 years, and they were forced to ask those questions. Some of them decided to call the family in when they asked those questions because they believe they're the ones that should make the decision as healthcare surrogate, family member, or pastor. But anyway, it was made mandatory in the Affordable Care Act. Then we changed the codes. And if they went early into the codes, they would get money back for the office. If they went late into the codes, they'd be penalized. If a person entered a hospital and under an HMO, they were only given 5 days to stay, and they came out and they went back to the hospital with the same diagnosis, the hospital and the doctors would lose points. Now, another thing that was implemented was the nurse practitioner in a bigger office seeing more patients than the doctor. She would see them maybe 4 times a year, and the physician would see them once a year. And the only thing she couldn't write was narcotics. We had double payers. We had many, many insurance companies, even for the med waiver and the diversion program. But after it was fully implemented, in 2017 it imploded, and many insurance agencies left the state of Florida, leaving some states in the United States with only 1 insurance agency. So now we look to President Trump to rectify with the Senate and the Congress if they can ever work together for the good of the people that elected them. So we'll see what happens in the future for that topic.